Are you struggling to find a successful treatment for your rosacea? Have you tried many remedies or creams that don't really work? Now you have to understand what rosacea is about. Rosacea is the manifestation of hyperactive blood vessels on the surface of your face that make them dilate and look inflamed. Like most of my patients that suffer from rosacea, you may have experienced some redness on your face or the impressions of feeling flushed. Some patients develop also pustules that look like acne. Others develop telangiectasias, which are little dilated blood vessels that look like they're little varicose veins. And some patients even tell me, Doc, I'm not an alcoholic despite having a red nose. All these manifestations of rosacea can be properly treated with the appropriate laser. Nowadays, we have very successful treatments using lasers that can reduce substantially the manifestation of your rosacea. You also have to understand that there is no cure for rosacea. The only thing we can do is control your rosacea and control the manifestation of the rosacea so that you don't appear flushed with all these manifestations that we talked about before with rosacea. And we do that using the appropriate lasers. How do lasers work? In our blood vessels, we have different particles called oxyhemoglobin. And these particles are very sensitive to lasers. So using specific lasers with very specific wavelength, we're able to target the oxyhemoglobin in the blood vessels of your face. Therefore, these blood vessels, when they absorb the energy from the laser, they heat up and they collapse and they close down and disappear, giving you a much more even tone without these redness and these patches of red that you have on your face. When patients come to see us to be evaluated for rosacea, this is what we do. When patients come to see us with rosacea, first thing we do is we take pictures of their face using this device, which allow us to analyze their skin complexion and to show us details beyond what our eyes can see. So here is an example of a patient that we treated for rosacea. And you can appreciate how much redness he has all over his face. And he has also little venules here and there. So using this software allow us to use different filters where we can see the density of capillaries and little veins and blood vessels that we see on his face that encompasses what we call rosacea. And you can see it, how much you can see here, you can appreciate how much he has on his cheeks, we can see how much he has on his nose, and we can see also on his forehead, extent of the rosacea that the patient has so that we can better target the problem using the appropriate laser to get the best results possible for the patients. Here is an example of one of my patients that was very annoyed by his rosacea, and as you can appreciate in his picture before treatment, he had developed severe telangiectasias, which are these dilated blood vessels on the surface of his face, which were quite disfiguring, to be honest. And you can appreciate the evolution of this patient after treatment, and you can see how much the lasers were able to help this patient. If you suffer from rosacea and you have trouble controlling it, I invite you to come and see us for a free evaluation so that we can draw up a treatment plan using lasers in order to help you finally get a control of your rosacea and give you this even tone without these redness and these plaques invading your face. Looking forward to seeing you.